Welcome to Untold Pleasure, the Cancer, Sex and Intimacy podcast. I'm Sarah.
And I'm Cheryl.
And we will be taking you on a pleasure-focused journey where we aim to end the shame, stigma and silence around cancer, sex and intimacy. Well, here we are at episode 6, and I can't believe that we've got here. I mean, it's absolutely amazing, and what a journey this podcast has been and what we have learned. I mean, I've certainly learned a huge amount. Would you say the same, Cheryl?
I definitely have. It's been fun. It's been a journey. It's been an experience, and a very different one.
Yeah.
But one that I really can take forward and say, everyone needs to hear this.
Exactly. And I think it's just having that bank of information, that bank of stories where people can come and listen and just hear themselves in the voices of the people that we've had on the podcast. You know, cancer, sex and intimacy is a deeply diverse experience, and to hold space for that is really what we want, with the project and the podcast. So today is a special episode because we are bringing questions gathered from our cancer community to a wonderful psychosexual therapist. So psychosexual therapy is something that is talked about a lot because it is something that can really benefit people if they're having kind of particular issues with their sex and intimate life.
It's a wonderful resource if you can gain access to it. And as you know, it's not always spoken about. Patients are not always told what's available. But
it sort of comes down to that kind of almost postcode lottery. You know, unfortunately, not everyone has it within their cancer centre and then affording it privately. But, you know, I know for me, I had it sort of about, I can't remember now, a year and a half ago. And it just helped me flip a bit of a switch in my head. And it told me that I am a valid person that can seek this kind of pleasure, of course, that my pleasure matters and that the people that I choose to be with, that really is a choice. And there are people out there that are willing to understand the body that I live in. And anyone who doesn't is not worth my time. But it did take that kind of therapeutic space for me personally.
And you know what? You're right. If they're out there and they don't accept it, good for them. Keep moving.
Exactly.
As you know, I've not experienced psychosexual therapy for myself, but I certainly know that when we had access to it, when we did the online workshops 2 years ago, it was a phenomenal resource. So for anyone that needs the therapy, I would say it's something you should consider. But we want to make it more accessible by bringing this information out in the podcast so everybody knows that the service at least exists. It might not exist in your personal postcode, but you might be able to gain access to some form of counselling therapy that can help you through what you're experiencing. So for this purpose, we're really, really excited to have Dr. Eleanor Holloway, a psychosexual therapist, talking us through this episode.
Yeah, completely. And just having that here as a resource, you know, there are things you can do yourself as well.
Of course.
Making those steps towards making positive changes, whatever they may be.
Absolutely.
The format we've decided to take for this final special episode is to contact our community, because at the heart of the Cancer, Sex and Intimacy project, it is all about that patient input, that lived experience, not just from myself and Cheryl, but also from the people that have been with us along the way. So we put out an open call on Instagram and we contacted our wonderful steering group. And we said, if you could ask a psychosexual therapist anything, what would it be? And we got some absolutely amazing questions.
Amazing.
Really amazing. They're really different as well, but touch upon issues that are very universal. So we think anyone listening at home will be able to benefit from this. Hi everyone, and I would like to introduce you to Dr. Eleanor Holloway, who predominantly goes by Ellie, so that's what I'll be saying today. So they are a doctor in sexual health and also a psychosexual therapist. Welcome, Ellie.
Thank you for having me.
So, Ellie, we're going to ask you a few questions about psychosexual therapy, especially for our listeners that might not really know what that is. So what is it that you love the most about being a psychosexual therapist?
I like lots of things about it, but one of the things I like about it is that people are choosing to come and see you. They're coming because they've got an issue which they would like some help with, and they're choosing to come to your appointment to see what help they might be able to get with that. They're not coming because they've been told they must come, usually, or because their GP has said, oh, you're going to have a stroke if you don't go and talk to that person. So it's what I would call choice medicine rather than more need medicine. And that leads to a quite positive motivation around what help you can suggest to people and that their motivation to take the advice and do something really great with it.
Amazing. So what is psychosexual therapy and what could someone expect from doing a course of it, either on their own or with a partner?
So psychosexual therapy is a type of talking therapy in the sense that you are going to have some appointments either in person or increasingly there's an option to do it by a video call consultation. And it might be by yourself or it might be as a couple. And in the appointments, what you're going to do is talk to the therapist about what issues you're having around sex and hopefully what suggestions they can make to change that. But the other really fundamental part of psychosexual therapy is a doing aspect of the therapist will be giving you ideas, exercises to do at home in between the appointments. And that's really crucial. If you just go and do the talking, I would say that not so much is going to change as if you really take up those suggestions and go and do them in between the appointments, exactly what's suggested at pretty exactly the frequency that's suggested. And then that's what creates the material that you're going to talk about in the subsequent appointments. It's not a therapy that's so much about delving around in your past. The therapist will ask you questions about yourself, how you've come to be in the place that you're in now. But it's not an analytical therapy that's about spending hours about talking about your childhood or your previous relationships. It's much more of a proactive therapy about where you are now, where you would like to be, and how they can help you find a pathway from the current place to the desired place.
That's very interesting. So what advice would you give to someone about finding the right therapist for them? Where can they look? And what does the private versus NHS options look like?
Some areas of the country have psychosexual therapy available on the NHS and some do not. And it's one of those things where there's been a local decision around funding it. I'd say if you want to find out if your area does, you can ask your GP if they know and they can refer you. And if they don't know, the next best place would be to ask the local sexual health service, probably. Where I work, it's the sexual health service that's where the psychosexual clinic is based within the sexual health service. But in other areas, it might be in a different place. So it might be part of a gynecology department, or some places there's some psychosexual clinic as part of a mental health service. But a local sexual health clinic, which every area has, will often know if there's a local psychosexual service, and if so, where it is and how you get yourself referred to it. If you don't have a local service on the NHS, or you just want to have more choice or be seen quicker, there's private people, I would say, around all of the UK. And also, even in areas where there may not be a lot of private therapists who you could see face-to-face, very local to yourself, These days, you're going to be able to find somebody who'll do a video consultation. And the best place to look is the website of the College of Sexual and Relationship Therapists. It's cosrt.org.uk. And they have therapist listings. Psychosexual therapists they're like the umbrella organisation that regulates us. And they have a Find a Therapist in My Area tool on their website.
That's really good to know, because I think it's, with a therapy that's so specific like psychosexual therapy, you want to have someone that has the appropriate training and experience.
Yeah, so that's being done for you if you go via that website, and they have different levels of members. So they'll tell you if someone's a student member or if they're a registered member or if they're an accredited member. And the word accredited implies a level of more experience beyond their primary qualification.
And then within that, you can maybe contact certain people and see if they have specialisms in your kind of particular needs and things like that.
Yeah, so sometimes that's listed on the website. There's a little description if they have particular areas of interest. And if not, I think anyone who is on those listings, who's giving contact details, would be very happy to be contacted and just ask the question.
Brilliant. And I think it's like within the cancer community as well, there's so many things that can impact your sexual health and holistic well-being with your sex and intimacy. But these are also things that aren't necessarily... They might have been caused by your cancer treatment, but by seeing a psychosexual therapist that maybe has a specialism in menopause or vaginismus or other kind of issues that can arise from cancer treatment, you can find that specialism.
Yes, I mean, I think you're completely right. My experience is that the problems that arise in sex and intimacy from cancer treatment or the recovery from cancer and cancer treatment are actually not so specific to cancer treatment. Having problems with your sex drive, with your libido, or having problems with vaginal dryness, they're problems which lots of other people are having for other reasons. And so lots of the ideas for help will be the same. So even if somebody's not an expert in your type of cancer treatment, they're likely to be able to have some really good ideas as to what can help.
Yeah, because for me, I didn't get a lot of support from my oncology centre and team around my intimacy and sexual health. But when I went to the sexual health clinic, that's eventually how I got referred to psychosexual therapy. And I was seen for what I was experiencing as a person rather than a cancer patient, which I actually found very helpful.
Good.
Yeah. Thank you, Ellie. That was really insightful. And thank you for all your wonderful knowledge and insight into what psychosexual therapy is and can be. And we hope that's been helpful to the listeners. Speaking of which, we have gathered questions from members of our Instagram community and also our wonderful Cancer, Sex and Intimacy steering group. And we have collected a series of questions that we are going to put to you now.
Excellent.
So I am going to bring you to Cheryl, who is going to give you the first listener question.
Hi, Ellie. Thank you so much for joining us. It's been a pleasure having you here. So one of the questions that were asked by the community was, how do you restart sexual intimacy after a long period of abstinence, possibly years, with the same partner you've had for that period of time? What sort of advice would you give on that?
The first piece of advice I'd give is to talk to them about it and just check that they also want to restart intimacy after a period of years. Because this question is about intimacy with another person, so that's going to take the two people. Talk to them not in a sexual situation. Don't wait till you've got half your clothes off to check that they want to change the plot as well. It's the kind of conversation I'd recommend having over a cup of tea and a chocolate digestive.
And not in the bedroom.
Quite separate, yeah. And then assuming that you'll both do want to get back to having some physical intimacy, I think the main thing I'd advise is not thinking about it as we're going to go back to what we did before and we're going to reverse the clock, somehow magically wheel time backwards and snap into how we used to be sexual together, but see it as a clean sheet project, see it as a new start of we would like to have an intimate relationship with each other, and that is going to be a new thing for us. We both need to discover what that's going to look like, how it's going to be. It might be different from how it was before, but that's not necessarily a bad thing. So
Something
sort of
new.
like starting dating again.
It's a nice way to put it.
In fact, I'd suggest that wouldn't be a bad way to go about it, to see it as a dating project.
Yeah,
tip.
I like that. So sort of maybe bring in a bit of romance or something.
Absolutely. Really not thinking about the first thing we're going to need to do is get naked with each other. That might be a half or 3/4 of the way along what you need to do to restart that project. And so thinking about how are we going to make this a different time and space, a different psychological space and physical space from our day-to-day life together, which it sounds like this person has been with their partner for some years.
Yeah.
And for years, that hasn't included sexual intimacy. So how are you going to mark that of, on Tuesday evenings, we're going to be doing this. And so if Tuesday evenings is date night, and on Tuesday evening this week, I'm going to invite you on a date, and on Tuesday evening next week, you're going to invite me on a date, then you hopefully have introduced an element of, oh, well, that might be something to look forward to. And now you've got the start of your motivation.
I like that. And I especially like the fact that you suggest the partners check in, that both of them are ready to be intimate, because what if the other person's not ready? So it's really important. Thank you.
Yeah, really love that answer. So let's say, let's say one partner has the thought, actually, you know what, I would like to start engaging in intimacy again, but the other member of the partnership is not ready. How do they have that conversation?
The main thing for me would be, if it's possible, for that couple to acknowledge that neither of them are wrong, that that's two people experiencing a situation in their relationship which they might be experiencing differently and might be affecting them differently. And it's not that the person who wants to reclaim sexual intimacy at this point in time is going too fast, or that the other partner is going too slow. It's that they're just in slightly different places right now. And if it's possible to have the conversation about what's making you push forward, what's making me hold back, or vice versa, and that might identify some things that they're not actually on such different pages as they think. The person who is saying, I don't feel ready for that now, might have quite specific things that they're anxious about, like, I'm worried that my body won't function like it used to. I'm worried if I'm in a situation where we do this and my body does this or your body does this because you've had physical changes to your body or functional changes to your body as a result of cancer treatment, that's what's holding them. It's not actually that they don't want the intimacy, it's that there's some specific things which, if those things could be addressed, or they could find out the answers to those things, or be reassured about the results, then that would enable those people to get more on the same page. And I guess my experience of them, maybe one of the most common things is that if somebody's approached sexually, they feel they can't join in with that, because if they start the beginning of that intimate journey, there is an automatic assumption they're going to follow it all the way through to some sort of full-on, long-lasting, penetrative sex, and maybe be expected to have an orgasm as well. And that it's I cannot possibly see myself following that through to the end. That stops them even starting the journey. I'm not going to kiss you because that will give you the message, I want penis and vagina sex in the next half an hour. And if you can have the conversation that allows you to break that down and say, having a snog on the sofa isn't a green flag for we're definitely going to have penis and vagina sex or any other particular type of sex in the next half an hour, hour, day, week, month, then actually everybody feels very comfortable to have the snog on the sofa. And then once you've had a month of having snogs on the sofa, then you feel different about something else. So I think it's that. It's about communication.
And setting expectations. I think as well.
And reassuring each other that no one's assuming things. No one can be a mind reader. It's not possible. But it may be the case that you're in a situation where one of you really does want some sort of sexual experiences and the other person really is not in a place to do that. And then that's a different conversation that different couples will handle in different ways.
And I think it's just being kind of adaptable to sort of knowing what each person might be sort of feeling in that time. And but a lot of what we talk about is the redefining of sex, like penetration, whether that's penis in vagina or dildo in vagina. You know, sex does not need to be penetrative.
It absolutely doesn't. But we are all suffering from a bad case of coming from a culture where we have been raised to believe that that is proper sex.
That's the
And
only
everything
way.
else is a little bit what comes before, what comes after, what other people do.
Yeah.
That pressure.
And we need to acknowledge that culture and then challenge it.
100%.
Thank you.
So bringing us on to question 2 from our community. So this person says, I'm in surgical menopause and on HRT, but still have zero libido. How do I get it back? Is it gone forever? My sexuality feels completely dead to me. So yeah, this is something we get a lot. The libido is a big issue. And here this person is also on HRT, which is something that is kind of supposed to help with that.
It does help some people. The first thing I'd like to say to this person is you almost certainly can get some of it back.
That's good.
It is not dead forever. But it certainly can feel like that to people. It can feel like if I never think about sex or do sex again, it'll be too soon. And you're right, it's common. And I guess one of the things to say is it's not just common in situations where your body has been changed. This person's ovaries have been removed and they're being given back some of those hormones. It's probably helping them with their hot flushes, but it's obviously not doing enough of a job for their sex drive. It's not just people who've had those type of physiological chemical changes who experience really dramatic problems with sex drive. It's a hugely common problem for human beings, all human beings. And I think a lot of recent research in human sexuality has gone into exactly this. And there's a lot of good, well-written literature about it, if people would like to read more about that. Is now a good time to suggest some of that reading?
Yeah, let's hear some books.
So I would say one of the best people to hear talk about the realities of human sex drive, libido, whatever you choose to call that energy, is Karen Gurney.
Yes.
And there's a very good TEDx talk, which you can find very easily on YouTube. It's called The Surprising Truth About Desire That Everyone Needs to Know. It's a very long title, but it's only about a 15-minute talk. And if you're interested, and that piques your interest, she's written a book called Mind the Gap, which I cannot recommend highly enough.
Brilliant book.
To summarise for the listener, what the research into human sexuality shows is that, again, it's a cultural mythology. It's a message we've been brought up with that sex drive is a hunger that is innate to us as humans that everybody ought to have. And if you don't walk around sort of every now and then thinking about sex or feeling like seeking out a sexual experience, then you're the broken one, because that hunger is a normal thing. And that's really not correct, it turns out, is that for many people, they are not walking around thinking about sex. They're walking around worrying about whether there's enough milk for breakfast in the morning, that they didn't answer that last email before they left the office, that nobody's going to remember to put out the recycling bin and it won't last another 2 weeks, and that it's not coming to any bit of their conscious mind, let alone the forefront of it. And for huge swathes of the population at times in their lives, they are not going to, what we would call spontaneously, have a spontaneous libido. And it's just going to occur to them to see the person who they fancy and want to rip their clothes off. Really at any time. And they could go along like that for weeks and months and years. And what is more common is that people have what we will call a responsive desire. So if they're put in the right place with a bit of available time and space, by which I mean physically uninterrupted time and space, but also psychologically uninterrupted space, and they're with the person who they fancy, and the washing up's been done, and the children are asleep, and the dog's shut in the kitchen, and their phones are on silent, then if they start to have the snog on the sofa, physically they will begin to get engaged. The physical process of the beginning of arousal will start to happen. And that's when whatever bit of our psychology that we might choose to call sex drive, that's when that begins to light up. It's actually a response to the beginning of the physical process of arousal that your brain sort of goes, ka-ching, I've remembered, I like this. And some people say it's, well, I don't want to have to organise myself into that. But that's the wrong way to see it. It's like anything else. If you wanted to do your yoga practice, you'd have to shut other people out of the room, put the right video on YouTube, get the mat out and be wearing flexible enough jogging bottoms. You know, a little bit of preparation is a good thing, not a bad thing. And so I think for many, many people I meet, the opening gambit of my sex drive is dead to me is true if they're talking about their spontaneous sex drive. But if you start to explore what could be a responsive sex drive, given the right circumstances and the right physical stimulus, they find it's there. It's alive.
And I think that's also that kind of language around it's quite powerful. Spontaneous versus responsive. And it's like kind of having that vocabulary to say like, okay, maybe this is what I can work on with my libido. And one thing I will just add, as someone who is single/dating and talking to the single and dating community, you know, say if you don't have a partner and your libido is on the floor, but you know you want companionship and you know you want to pursue a sex life of sorts. How do you kind of work up that libido when there isn't someone to have a snog on the sofa with?
Yes, I think there's two parts to that. I think maintaining a physical relationship with yourself can be helpful.
Bit of masturbation.
Or solo sex.
Solo sex.
Solo
I like
sex.
it.
Get it on.
There's something about the word masturbation that many things about that word that I'm trying to shed. So, yeah, maintaining a positive, sensual relationship with yourself, I think can be helpful. And also maybe having a little cup of tea and a chocolate digestive with yourself, or talking this through with your counsellor or your psychosexual therapist or your mate about, is everyone else on that dating scene actually what they're all looking for is red hot sex? Because I think it's a very common current perception. And for some people, they would say, well, look, I know what you're saying, Dr. Holloway, but you know, you're old and you're not dating and you're wrong. That is what people are expecting. But I meet all the young people who can't or won't or don't want to fulfill that red hot sex on the first date narrative. And there are lots of them in my clinic. And so I can tell you statistically there's other people in the dating scene whose sense of relief if they heard the sentence, I don't really want to have full-on sex in the first few dates. Could we just take things a bit steadily? Their sense of relief will be so huge.
And it's okay.
People don't think those other people are out there. I can tell you they are.
Definitely. And I think it's, finding the right apps and kind of put it in your bio, like for me as well. Because, I don't want red hot sex on date one. And a lot of the people I've been meeting recently also don't. And when you talk about it, you it's suddenly the room just opens up and eases and everything feels a lot more fluid and enjoyable.
And that's when that little responsive sex drive might just start to
It's like, oh, I feel a little...
flicker its little...
Yeah.
Equally, you could meet someone, you both say that to start with, but, that dynamic between you on that first date is so explosive that you both want to go for it.
You never know.
It might be
fabulous.
But it's that. It's the conversation. It's the easing the tone and just like allowing the space to be kind of what you want it to be in that moment. So
Absolutely.
thank you. I love that. I love
Just
that.
to come back, Cheryl, a little bit, the sex therapist in me would say if you've said that you're not going to have sex on that first date and then you turn up and the chemistry is really positive and explosive, no harm in sticking to plan A. That is sex drive, while I'm really looking forward to the second date.
Oh, wow.
And the third one.
That's a good point.
I like that. Almost like a
No
tease in
harm.
yourself. A
Yeah.
tease.
No
an
harm in
underlying
sticking to
tease
plan
that
A.
you keep going. Nice. I like that. So, Ellie, question 3. How can I move past my partner struggling with changes to my body? My partner was depressed during my treatment and made some negative comments. We've moved past it now, and they're in a better place and on antidepressants. Now things are a lot better, but it sticks in my head. How does this individual who has had cancer, who's now experiencing this overall situation, how do they move past the fact that times weren't so nice at one point and, things might have been said and they weren't so pleasant? How does that person move forward and have a sex life with this individual who's now sort of turned the corner a bit with their own depression, but, things stick in your head when things have been said?
Again, I would say the first thing to do is to try and start with talking about it rather than plunging into doing it. And open up the conversation, not in a sexual situation, about are we in a space now where now we're ready to make a positive change between us? The thing about depression is that it's very negative. It's very negative for the person whose mood is low.
Okay.
It's the nature of depression that you think in a very negative way about most things when you're depressed. That's not your fault. It's not your choice. That's what depression is. And so if you're depressed, your partner's going through a cancer treatment or recovering from that, you may well think very negatively about that and the prospects of change out the other side of it because you're depressed. It doesn't necessarily mean that that's your real, conscious, thoughtful judgment about it. When you're depressed, you're never going to get another job. You're never going to find the right flatmates. You're never going to find the right house. There's no point in going and joining the rambling club because no one there will like you and they'll walk too far and it'll rain. Okay. Because that's what depression does. And I think if you can acknowledge the space you were in when those really difficult things happen, and that maybe if mood has improved, hopefully, the person who was depressed, their mood has recovered through therapy or antidepressants or just time moving on, that you can have an honest conversation about, I'm in a different space about this now, and this is how I truly feel now. I feel positive and I want to move forward. You can't wind back the clock.
No.
But you can do some talking about why you felt like things at that time. And because we can't see mental health, if somebody can't walk because they've got a broken leg, everybody understands that. But if somebody can't get out of the house and socialise because their mood is too low or they're too anxious, we treat that in a different way. Societally, we treat that illness in a different way than we treat the broken leg.
That's right.
You can't get off the sofa because you're vomiting so hard because your chemotherapy is treated in a different way of you can't get off the sofa because you're so anxious that leaving the house would create a panic attack. And we have a different level of blame attached to those things, which I think is another sort of societal more that we could do with a bit of questioning.
So what you're basically saying is they will need to revisit what may have been said when the person was feeling low, or just...
Maybe just have a conversation about how things are now.
Okay.
of, are we in a positive space now that we want to move forward and do something positive between us? That can be difficult if people have said things to each other which they kind of can't get over and move forward. Then I think that's the time to maybe think about going and talking to someone else. Maybe have a few sessions of couple counselling, not sex therapy, but more relationship couple counselling about how do we move forward from this experience we've had together.
Really good advice, thank you.
Yeah, there's always things that can be done. I think it's hard when one partner's been unwell physically and then depression has come in from the other side of the partner of that person. And how to move forward, how to get past that. But there's so many options, the communication, the couples therapy, and just knowing that there are things out there that can make positive changes. So we're coming on to question 4. And again, this is something that comes up a lot. So the question this person would most want to ask is, how does one regain intimacy with your partner after all the medical appointments have destroyed your sense of your body as being your own? How do I help my brain differentiate from sexual, emotional, intimate touch from medical touch? How do I see/recognize myself again after such a profound change?
I think you're right. I think this is a really common problem. First thing is to say, it's okay to feel how you feel now. That's normal. And that reclaiming can definitely take place. It's not a situation that I think a person should feel hopeless about at all. When you've had doctors and nurses hands all over you doing different things, drawing with pens the bits they're going to cut and, putting needles here, there and everywhere and injecting poisonous drugs, it's okay to feel like that. And it's okay to feel like you have to come out the other side of that. There is some reclaiming to do. I think the first thing to do is totally forgive yourself for feeling like that is a journey that needs going through. It is. And then I'd say for not everyone, but a sizable majority of people, doing a bit of reclaiming my own body for me is going to be helpful before my body is reclaimed by us, a couple, for sex as a couple. So if an individual has not grown to feel comfortable with a changed body as an individual for themselves, they're nervous about how sensation's going to be on a particular bit of their body that has scar tissue, for example. Or they're nervous about how a bit of their body is going to function. Will I get an erection in a sexual situation? I don't even know. I'm definitely nervous that I might not. My bladder control is not as good. My bowel control. You're nervous about physically what is going to happen. Discovering some of those things in the privacy of your own space, for a lot of people is going to feel a safer way to start that journey than immediately diving into bed with your partner. And in sex therapy terms, we'd refer to that as a bit of self-focus, I guess. And there's quite a lot of resources that can help around that, as we're into directing to resources. So there's a helpful app called Furly, Ferly.
Oh, nice.
And it's available on any normal app store. And it does cost money, but really not much.
Yeah.
It is made for women, for people who identify as women. I don't think a lot of the things that they talk about would not be unhelpful to someone who identified as a man, but it is directed at women. And it talks about a lot of different things, but one of the things it talks about is working on, reclaiming, changing your relationship with your own body in a sensual and moving on to sexual way. And it literally has little exercises you can do.
Oh, wow.
So it asks you questions like, what is it you want to work on? Is it your confidence or your sensuality or this or that? And then it'll lead you through a little pathway of suggested exercises, or you can kind of go to menus and choose your own. And it's got guided meditations, it's got guided self-touch exercises, it's got people reading out bits of erotica that you can listen to. It's got quite a lot of information, little slots about, for instance, the one I listened to on my walk from the tube station yesterday was, what is an orgasm?
Nice.
And so it's full of really good factual information mixed with ideas about things you can do for yourself. So something like that, or if you're more of a book person than an app person, there's a very good book called Better Sex Through Mindfulness by a woman called Laurie Brotto. And again, that gives you some theory, but it also gives you some practical exercise suggestions of how you can get into a different headspace with your own body that then gives you some things, some confidence to take to a situation with a partner. The real nub of the whole thing is being able to, I would use the phrase, get out of your head and into your body. So concentrating on not judging how is my body going to function in this situation? What is my chest going to feel like now? What if my legs don't work the same way they used to? What is another person going to think? Will I be able to X, Y, or Z? Trying to not have your attention on any of those things, but it's sort of like a meditation practice. Can you focus your attention on how your body actually does feel now? If I touch my arm, how does that feel compared to if I touch my neck or where my breast was? Not prejudging the situation, but saying, actually, this is different. I can't get around that. It's not how it was, but there's still good bits.
Yeah.
And trying to keep your mind on my body now, what sensations I get. And when the worries come and the judgments come, but that's not, just try and, they're a thing, but they don't have to be the thing I'm concentrating on now.
So mindfully kind of focusing elsewhere.
Not elsewhere, on my physical sensations. Yeah. And if you're ever short of a physical sensation to focus on, you've got your breathing.
Which is, the key thing in mindfulness, the breathing. So thank you very much for that. Moving on to question 5. This question is so common.
Yeah.
Somebody's asking for advice on how they meet people after a cancer diagnosis. How do they approach them? When's a good time to tell someone you've got cancer?
Well, I'm no expert on dating. I'm going to have to defer to someone else.
Don't look at me, no.
When's a good time to tell? That'll be different for different people. There's no right time. It's what's right for you in a particular situation. There could be a situation where you want to, if you were using a dating app or some matching site, you might want it to be part of your... what do you call it? A bio?
Your bio, yeah.
Your bio.
And I've seen
you might want it
yeah.
to be part of that so that it's out there on the table. There isn't something to tell because if somebody was using that properly, they've read it already.
Good point.
Or for other people, it's not information they want to share with everybody. So they're not going to want to tell everyone in advance. And there's going to be some point where you think, A, I feel comfortable enough with this person. And B, I think there's enough of a reason to share. Like, I do think we'll meet again. I do think there's some sort of prospect, medium or long term beyond this date right now, where I feel comfortable to share this information and it's worth it. My advice to people is to actually rehearse how you're going to share the information, to have like a little speech. Really, a speech is too long a word, a little short. It could be as short as one sentence. But have it planned so that you're not left on the hop struggling, thinking, what am I going to say?
Yeah.
How do you explain this? So for instance, I don't know, I just wanted to let you know that I had breast cancer and I had some treatment. So that's had some effects on my body I sometimes have to take into account. Full stop. What would you like for pudding? Are you going to order pudding? Should we have coffee or should we just get out of here? It doesn't have to be, you could just put it out there. Doesn't have to be a big thing, but it's just open the door of that person. They might immediately ask you a question, or they might not, but they know it's, at some point they can come back to you and say, oh, I'm really sorry to hear about that cancer. How did it affect you? Or what sort of situation does that affect you in?
And I think depending on the relationship, you will know whether or not you even need to tell that person if that relationship is going to move forward or not. I think your instinct will tell you, I don't need to tell this person. I'm not going to meet them again.
Yeah.
Yeah, definitely.
That's kind of what I meant by, is it worth it? If you think you're never going to meet them again, you might say, well, this person just doesn't need to know. I think for the majority of people, if they do think that their relationship is going to go forward and they do think it's going to become sexual, surprise and sex, for some people that goes together, but I'd say for the majority of people, real surprise and decent arousal are not good bedfellows. So I think finding a way that's comfortable for you to say, for example, if you had a mastectomy, whether or not you'd had a breast reconstruction, that you might want to give some information about that to a partner before you took your bra off. You might not, but I think for the majority of people, again, communicating that over a cup of tea and a chocolate digestive is going to be more comfortable than waiting till you're naked.
By doing that, you give yourself the best sort of access to pleasure there. It's not so much about the partner. Like, they are going to respond. You don't know how they're going to respond, but in you saying that and feeling that you're with someone that will take that information positively, you've sort of set the tone to make, if you do become intimate, a much more pleasurable and positive experience.
And also, if you haven't shared that information, then you're thinking, well, what are they going to, are they even going to notice? You might have had the best plastic surgeon south of the Wash, and they might not notice your breast reconstruction. But then you might have an anxiety of going, well, they might not have noticed. And then if I don't respond to that breast being touched because actually I can't feel it, then that's making me, and anxiety is the enemy of arousal. So any unanswered questions, uncertainty, I don't know how it's going to go, all of that, that's something that's doing the opposite of helping, putting yourself in the best chance of in a place where you're going to be able to relax and get aroused when you're there.
And really kind of working out what kind of pleasure or sex you want to experience. Like, because I know for me, having vaginismus, which I have touched upon in other episodes, but for those who are coming to this episode as the first one, vaginismus is an involuntary tightening of the vagina, any kind of penetration, finger, dildo, penis. And you might be able to elaborate on it even more than me, but it's just like, yeah, so that is something I do need to bring up, because you don't know what kind of sex your partner is expecting or wanting. And, expecting is the wrong word, because no one should expect anything from anyone. But, maybe they have that mindset of what sex is. I know that I actually don't want penetrative sex, not interested in it at the moment. So I bring that to the table, and I know it's kind of a green flag for me. If I mention that on date 1 or 2, I know I like this person. I trust this person. They're giving off an energy that makes me feel safe. And when I mention it to people, and especially the people I'm dating at the moment, it's always positive, and they are interested in exploring routes to pleasure that are great for both of us.
Yeah, absolutely. I think, again, there's this expectation of people with vaginismus of, well, how am I going to present that to potential partners, because they are going to be expecting some sort of penetrative sex, vaginal penetration of some sort. But that's a cultural expectation rather than actually all the potential partners are living with that expectation the same as you are. And they might actually, the number of people with penises who are going to hear that, actually, I'm not that interested in vaginal penetration, or I can't do that, or I might be able to sometime in the future, but it's not going to be anytime soon. The relief, they go, oh, well, instantly their erectile dysfunction becomes less of an issue for them, because they know they're not going to be expected to fulfill that.
And, penetration is sort of a kind of sexual act that is across many different kinds of relationships in whatever form it takes. But that really doesn't need to be a key factor. And it certainly isn't for me now and the people that I'm experiencing pleasure with. And I think it's exciting for a lot of people to try new things if that was the sort of sex maybe they were having previously. But yeah, as you say, I've met a lot of people, both penis owners and not, that aren't interested in penetration, or, it's not their number one priority.
Or they might be interested in, but they're also interested in many other things as well. And, many other things that can be more pleasurable.
Exactly. So it really is just allowing yourself to open the doors to the whole spectrum of sex and intimacy. And it might take a little more time, but the people are out there. And I think, like you were saying, Ellie, certain apps, people do just whack on what their desires are, which can be great, and that's actually really good for me. Yeah, you can put it in your bio. I've seen people that put that they're recovering from surgery or chemotherapy. I have seen that in people's bios. And I used to put it in my bio. I am now 5 years in remission. But what I talk about now is, I say I don't want one night stands. I'm interested in developing connections before intimacy comes. And, if people aren't interested in that, they don't have to like me.
There you go.
Absolutely.
So is it me now asking the next? Oh, sorry, go on, Ellie.
I was just going to say something about vaginismus.
Yes, please.
It's a very common problem that still a very common experience for somebody who is experiencing vaginismus is that I'm the only one. I've never heard of this. My body's definitely broken. And I'm not like everyone else, and I can't do the things that everyone else can do. And vaginismus is enormously common. I could fill my clinic only with people with vaginismus, and my waiting list would still be too long. It's a hugely common problem, and people need to start talking about it because your body is absolutely not broken. It's just behaving in a particular way at this time, which may be a short time or it may be a very long time. And the thing that's doing the squashing down of the vagina is not actually the vagina itself. It's the pelvic floor muscles that surround the lower vagina. And they're muscles. And they can behave in different ways at different times in your life. And they can have reacted to things like a surgery in the area or radiotherapy in the area. Or it can be a reaction to an experience, a sexual experience or a non-sexual experience. For some people, it's just how their pelvises are built. They have very strong reactive pelvic floor muscles that it doesn't take much to trip off a sort of a muscle is, I don't know the word I want to use, it's changeable. You can teach muscles to behave differently. Vaginismus is absolutely treatable, and that needs to be at the right time when somebody is motivated to do that change and it is physically possible for them to do it. So that sometimes there's a physical reason why your muscles are just going to behave like that at this time.
But I think that's where some of the healthcare professionals really do need to pick up the subject of vaginismus and not leave us to find out.
Yeah. Or just give you a packet of what should not be called dilators or a leaflet of where to buy them and say, if you have this problem, use these. Full stop, no other information.
Because that's sort of a bit like, right, okay, bit terrifying, no guidance.
I think it is. But that guidance is absolutely out there. The first website I go to for anyone who wants to know more about vaginismus is called Hope and Her.
I think it's that for, vaginismus, other kinds of painful penetration, a lot of these triggered by cancer treatment. There is that support out there. There are practical solutions. It's like, but then within that therapeutic space, that kind of healing journey that can take place, it's hard when, as someone experiencing cancer, whether you're in treatment, living with or beyond, if you're not asked, if you're not sort of told that these things might happen, you do feel very lost when you experience an impact upon your sexual health or your sexual life. So yeah, it's a minefield that, but it's wonderful to know help is out there. I think a lot of people don't even know that psychosexual therapy exists.
No, some people turn up in my clinic and their first question is, where am I?
Yeah, it's sad, but it's also very true. I mean, I don't know when I learned about psych. It certainly wasn't that long ago.
But I think it's also a bit important not to put psychosexual therapy on a pedestal and say, oh, well, unless you can get so many sessions of that with a really experienced therapist, then you can't have access to any of these ideas. That's not at all true. It's a set of ideas. I was going to say assumptions, but it's a set of lack of assumptions and some knowledge which is available to people on many different levels. You could go the whole hog, if you like, and have a course of psychosexual therapy, or you could do some reading and get some books and listen to some things, listen to this podcast series, for example, and get some ideas which just allow you to open some doors and have a different conversation with a partner or a potential partner or with yourself and just free things up enough. It's very rare that things have to be perfect.
I think that's such a good point because like we spoke about at the beginning, like therapy or psychosexual therapy, it just isn't accessible to everyone. If there's not a clinic or if you can't afford it, but there are things that you can do. There's wonderful resources that you've mentioned, apps, books, and also, the tips we're talking about now, that solo pleasure, the solo sex.
And look, you can buy some lube. How have we not mentioned lube yet?
Oh, lube is an absolute number one go-to.
Yeah, we love lube here at Cancer, Sex and Intimacy. Actually, Ellie, do you have any, I don't know, what are your top lube tips?
Oh, I've started it off now. My top lube tips are lube, and more lube.
Nice.
And the plainer your lube, the better.
Irritant-free.
You don't want the Halloween special pumpkin flavoured glow-in-the-dark sparkle. That's not the one you want.
No.
You want the one that has pretty much nothing in it. So am I allowed to mention brands on this? Or is that not okay?
No, I think brands, we've mentioned like Yes Organics in the past.
Yeah, so the Yes Organic range are really well-liked and really plain.
And it's available on the NHS
in
prescription?
some areas.
Yes,
I think that depends on your
lottery.
Prescribing rules for a particular area. So you'd have to ask your GP if they can prescribe it rather than tell them they must. There's also a very nice plant-based lube called Silk, spelt SYLK, that's very good unless you're allergic to kiwi.
Which some people are. So
people with that like fresh fruit thing might not be the best one for them. And there's a range which is a German range called, I don't actually know how to pronounce this, Pure Med. It's spelled PJUR. And there's an umlaut over the U, but if you Google it, you don't need the umlaut. PJUR Med, MED. And they've got a quite ginormous range of lubes to the extent where I really don't know how there can be that many different combinations of ingredients.
Wow, and that's all still no nasty stuff.
They're plain. They're the pH balance. They haven't got any of the additives you don't want, and they do water-based lubes and they do silicone-based lubes, which are more slippery.
And that's more for like maybe anal play rather than vaginal.
No, I'd say it's for anything.
Okay,
I'd say a hand massage
with
a nice silicone lube is a lovely thing.
That's a really nice thing to bring because it's not just about the genitalia.
It's not just about your genitals. And silicone lube, it stays slipperier longer. Water-based lube is absolutely great, but it kind of evaporates and vanishes. And then you need to add more. Silicone lubes hang about a bit longer.
Excellent.
I like it.
Thank you.
I've learned. I haven't heard of this German lube. Every time I think I know it all, I certainly don't. And that's something to take away from this podcast, certainly. Right, so we have another listener question. So how can you remain intimate with your partner outside of having intercourse? So, for example, during periods of treatment. I guess intercourse that's the kind of technical term for penetration in a way, isn't it?
It's a slight, what people used to, or vaginal intercourse is like a previous, I don't want to call it old-fashioned because that sounds judgmental, but a previous way of saying penis in vagina sex.
Or maybe what society has given us as our language. So yes, what can we do outside of that?
You can do anything you want. But that's not so helpful, is it?
A silicone lube massage sounds great.
A silicone lube hand massage. Often I say to patients when they first arrive in clinic, I have to qualify when I'm asking them, basic questions about their sex life. I say, bear in mind, I am no longer normal. I've moved to planet sex therapy. There's no moving back for me now. It's too late. But when I say the word sex, I'm not implying a penis in a vagina or a penis in anything.
Or a dildo or something.
Or anything in something.
Yeah.
I'm talking about if you've got your hand up your partner's T-shirt, sex has started.
There you go.
Nice.
And so, again, having that conversation over a cup of tea with a chocolate digestive of, we want to maintain our physical relationship. Just at the moment, that bit is too sore or not working or doesn't get stiff enough or doesn't get lubricated enough or whatever it is. So where's the broader definition of sexual intimacy that goes, sometimes I talk about it as a menu. Steak and chips. Currently, steak and chips gives us indigestion. Starters. What starters do we like? Soup. How about soup? Salad, pasta, fish courses, vegetarian options, vegan options. We could not go savoury. We could skip straight to pudding and just eat puddings.
That's what I do.
There's a cheese board. There's coffee. There's a chocolate liqueur tray.
God, this menu sounds amazing.
There's a lot of... And if you're a bit short on, we've only ever done steak and chips. We think going out to eat is steak and chips. That's all our parents did. It's all we were told about. We've never cooked anything apart from steak and chips. Then, get a book.
Yeah.
Watch a video to give you some ideas.
I know. Bit of erotica, bit of audio erotica.
Both put your pants and your bras, even if you don't normally wear a bra, you can wear one or wear an invisible one. Put your pants and your bras on and play touching each other with lube everywhere your underwear is not. It's a good game.
I like that. Bit of blindfolding maybe. I don't know. Just
Blindfolding's a thing.
Yeah.
Or you can just shut your eyes.
Yeah. Sometimes the best toys or the best tools are the ones you have at home. Closing your eyes or just finding, what was it, that Renee from the wonderful Shush Women's store, the fork.
That was a fork.
The fork on the skin.
Closed my eyes and she run the fork up and down my arm and it was the most sensational feeling I've ever had.
Yeah.
I did once send a couple home to do their still out. They were quite early in sex therapy. So they're, if not actual underwear, invisible bikinis, I refer to them as. You still have to wear your invisible bikini, I say. So everyone's still got their invisible bikini on. You can't touch where it is. And they've done this touching exercise for a few weeks and then you think, we need to change this up a bit. So you say, find some things. You could use some massage lotion. You could use some body oil. You could do this exercise in water, in the bath or the shower. You could use some ice or anything you can find. They came back and they said, I found the thing. I said, what is it? They said, the kitchen scourer. You're like, oh. Each to their own.
Yeah. But that's it. The skin is this huge erogenous place.
Yeah.
Isn't it supposed to be the biggest organ in the body?
It's a lot of surface. It's a lot of surface area.
And a lot of sensation to have. Oh, I love that. I absolutely
love that too. So moving on to the last question from our community. I became my partner's carer when he became ill with cancer. What advice would you give in maintaining a relationship whilst being someone's carer? We know that's a really difficult space to navigate.
I think that's a really common experience too. First of all, 11 out of 10 for looking after your partner.
Yeah, absolutely.
I think it's a personal experience that's going to be different for different couples. And it partly depends on what type of caring you'll have to do, how physical that caring is. There's a difference between I've now got to do all of the housework, cook all the meals, put the children to bed every night because my partner is too shattered to do that due to their chemotherapy. That is maybe going to be a different experience from I have to help my partner wash in the shower. I have to physically help them walk up the stairs, get undressed and get into bed because they physically cannot do that by themselves. So it partly depends on the nature of the caring And that's going to have a different physical and emotional impact on different people in different ways. And it partly just depends on you as a couple and how that is for you as individuals and your family construct. So I think it is going to be different for different people, but for a lot of people, that change of role is very different, and a change in balance of roles of I'm physically, practically the person who's able to do more than you are at the moment. And then for some people that can turn into a bit of an actual or perceived power imbalance. And the person who's having the cancer treatment or recovering from it is not just that the other person's doing new things they maybe weren't doing before, but the person with the cancer is unable to fulfill roles that they were previously fulfilling for that couple, for that family. And that can have a huge effect on them. And so from both sides, there's a lot of change going on. And I think acknowledging that change, being able to communicate about it, and again, not having a mindset of, well, if we're going to stay physically intimate, we have to be able to put the clock back. It has to be like it was before.
It's impossible.
It's impossible. So you have to then do a little team project of, well, what is possible, what's realistic in terms of time and space and energy and pain and medication. You know, if I've got to take my slow release morphine by 8 p.m, because otherwise I am going to be awake in pain at 2. And I know that, but taking it at 8 p.m. means I'm going to be conked out by 9:30. Then there's really no point in planning that you're going to have any sexual intimacy when your partner gets to bed at 10:30 p.m, is there? This is not that you want to be out. So really thinking about the practicalities of the situation and how can you do something that's probably different, maybe new, but is going to be good for both of you. And that might be, I'll just get in the bath with you. Or it might be, actually, I can't move from this sofa, but if you sit on the other end of it and give me your bare feet, I will give you a really nice foot massage.
Or climb into the bed beside them and just give them a hug.
Exactly. It's probably not going to look, in that moment of your partner's illness, look like the red hot sex you were having 6 months ago or 2 years ago or 6 years ago or 25 years ago. But it might be even more intimate and bonding. And it's something for that moment, isn't it? It doesn't have to be what we were doing or what we're going to do. It's about what's right for now. And just checking out before you know, would you like me to climb into the bed with you?
Asking the question.
Would you like to climb into the bed with me? You know, some people don't realise you can fit 2 people in your average hospital bed, but I'm telling you, they're quite wide. Yeah? Hospital mattresses have plastic covers, right? So you can wipe them. And sheets slide across them dead easily. So even if somebody's a bit tired to like literally shuffle themselves to one edge, just give the sheet a really strong pull. Get them over to one side, get in the other side.
And that's nice.
that.
I like that.
If you've been invited.
With their
If
permission.
you've asked the question.
And if a medical professional then walks into the room and looks surprised to find 2 people in that bed, you just look back at them like, I don't know what you're looking at. This is the most normal thing in the world.
That's right.
I don't know why everybody else hasn't got 2 people in their bed sometimes.
That's right. Exit and draw the curtain, please.
Do not disturb. Well, that's it, like intimacy in
Or
hospitals.
just, please come in. Come in. You're welcome. But,
A new
you know,
type of
actually, frankly, it
threesome.
took us 15 minutes to get in this position that's comfortable to have this cuddle.
Join
So
us.
if you could just change the syringe driver without disturbing us, that'd be lovely. Just change the syringe driver on your merry way. We're very grateful. Thank you.
It's like adapting the intimacy to the space. And like there will be periods of time, you know, if a partner is particularly ill, maybe it's an end of life experience or something.
Yeah.
But that intimacy is allowed in those medical spaces.
Absolutely. Hospices are very good at these things.
Yeah.
Excellent.
Yeah.
they are.
And if you say to the hospice, we need a double bed for 2 hours, do you know what? They'll probably try and make you one. If they don't have a relative's room with one that they can lend you, they'll probably push 2 beds together, put 2 mattresses on the floor and hoist you there. If they,
Oh, very
your
accommodating.
average hospice is going to join in with that project.
That's brilliant. And that's powerful knowledge to have, I think, because until you know.
And knowing that it's okay to bring that up.
Yeah.
You're not going to be judged
Yeah.
for raising the topic.
I think that's it. That's kind of the testament of what we want from this project, this podcast, is that you are entitled to that intimacy
Yeah,
and that
absolutely.
pleasure as an ill person.
Yeah.
It's a human right, I would say, to experience that very, very natural thing.
And I think the fact that not all oncologists and oncology specialist nurses and radiotherapists talk about it that's really a testament to the culture we've all grown up in
Yeah.
of not talking about
That
sex.
silence.
It's not that they don't know and they don't care and they don't want to help. It's that they've grown up in the same culture. We all have. But the more of this goes on and the more people do talk about it, then we can start to change that script.
Yeah, exactly. Well, thank you so much, Ellie. I think, I really hope both the listeners that submitted the questions, but also all the other listeners that are joining us on this podcast journey have benefited from that. And we are going to go to our final question. Passing the dildo. Passing the dildo.
Give us the ear.
All right, give us
Gold and sparkly. What's not to like?
Boing. So yes, Ellie, this is our final and most fun question. And this is something me and Cheryl have answered 5 times already. So we are going to bring something interesting to the table. Fingers crossed for the final question. But first, we bring it to you. I'm going to pass you this lovely...
I actually get to hold the dildo while I answer.
You do. That is the talking stick.
Can I praise your dildo? Is that allowed?
Could you describe it, please?
Well, the thing I'd like to say about it, it does sparkle, which is nice. The thing I'd like to say about it is I like the size of it. Like that is about a normal size erection, which is very unlike what most people, or if you say to them the word dildo, I think what it conjures up for most people is something about twice the size of that, which is then necessarily a little bit scary.
Yeah.
It's a little bit scary for people who own penises because they think, oh, I can't be big enough. If that is what people want to buy, spend money on. It's a little bit scary for people with anything that a penis might go into. They think, oh, how do I accommodate that?
That's a good size.
So this, if we could just advertise that this is normal.
We need a photo.
Let's not use the word normal because there's no such thing as normal.
Yeah.
Let's use the word average. Statistically quite average.
And I must say, so this dildo is cast in the bespoke casting factory by the Shush team. So this is
This is somebody's erection.
Yes.
But only they know who. You have to cast something.
I don't think it's a direct cast. I think it's made to...
It looks natural.
Yeah,
it's got a very gentle curve on it.
Yeah. And again, this can be used in a strap-on. It can just be used solo, however you want. So I will pass the dildo back. So Ellie, what is your favourite way to create intimacy that is not necessarily in a sexual way?
So it depends how you define sex. So what my answer to that is I would call it sex. But the more average, normal human being, not using the word normal, the more average human being who doesn't live on planet sex therapy might not call it sex. So I think I'm going to repeat myself, but I would say my favourite way to create intimacy, which isn't what is averagely labelled as sex, is taking time and space for some deliberate touch. It might be a hand touching a hand, or a hand touching a foot, or a hand touching a cheek. That might not even be very sexual, but it's a sensual thing, and it's a thought through thing of we, as the toucher and the touchee, have created this space for each other. Please, may I touch you? I would like to be touched. And then really paying some attention to that touch.
I really like that. And I really like that you picked up on the language there, because this is what we're kind of trying to do, like finding the right language to say, like, what is intimacy? What is being sexual? So thank you for that as well. And thank you for your lovely answer. Cheryl, I'll pass you the dildo. What's your favourite way to create intimacy?
Well, I like swimming. And because of swimming, you have to wear a costume. in a public setting anyway. So I like choosing costumes that expose different parts of my body and still help me to identify as feeling sexy in these costumes. So I have got so many swimming costumes. Some missing bits at the side, the back, the front. But that's another way of me connecting with myself and feeling sexy.
So that's about it being intimate with yourself.
With myself.
Excellent.
And you know what? For my answer, I must take this gorgeous dildo in my hand. I'm going to be inspired by you, Cheryl, because, all right, as I said, we've answered this about 5 times now, and I'm going to just tell you a little story. So the other day, I bought myself the most gorgeous red PVC bra. It's very kinky. It's very gorgeous.
Sarah.
And you know what felt the most amazing thing is wearing it and feeling it under my clothes. And I was just stroking it, kind of, just on the tube if no one was looking, but just feeling this lovely sensual material underneath my clothes. Didn't matter that no one else was going to see it. But I felt wonderful.
It was for you.
It was turning me on just wearing it, It was wonderful. So that solo sex was beginning on the tube for me.
There you are.
I love that.
So thank you so much, Ellie, for all of your wonderful knowledge and answers this session. It has been a joy.
Thank you very much for having me.
Thank you, Ellie.
As ever, an amazing discussion. So thank you so much, Ellie, for taking the time to talk with us and answer all of those amazing questions that our listeners brought to us. I mean, they were brilliant, weren't they?
They were absolutely phenomenal.
Yeah.
I'm really grateful that they had the courage as well. It took courage to ask those questions.
And they're going to help so many people.
So many. I really just want to kind of focus on paying homage to those people because it couldn't have been easy, to actually be experiencing something or experienced it and then to have to put it down in writing and then put it out there, even though it's anonymized. It's your journey. It's your journey that we're speaking about, and it's the answer that you're getting. What do you do with it?
Yeah, but how that can help so many people, because we do find there's so many areas of cancer, sex and intimacy that resonate across the board.
Absolutely. Things cross over. There's no kind of clear boundary between one side and another. It kind of flows and merges and twists and turns. But, this podcast has just been a journey of finding out exactly how you navigate those twists and turns.
The uniqueness, the wonderful unfurling people that we are, and what we've been through. I mean, we've been joined by so many people directly affected by cancer who are sharing their experiences, and that's such a generous thing to do. That's the most beautiful thing about this project, like what people are willing to give. And for that, we just want to say thank you. And thank you to everyone who has listened on this journey. And we want this to be like a bank of resources. Even if you don't have cancer, listen, because what is it? 1 in 2 now people are going to be affected?
1 in 2.
Yeah, because this is something that you could support a partner with. And yourself, a friend. There's so many ways that we want this resource to kind of live and exist in the world. And also the healthcare professionals. We were joined by Ellie today, who is an absolute shining example of how supportive healthcare professionals can be.
And we had Dr. Liz O'Riordan earlier on in the podcast. I mean, to go from one experience as being a breast cancer surgeon to having breast cancer herself, that's a really unique journey.
So unique. And what that journey can bring to the wider experience is just so wonderful. And of course, we can't forget to mention Shush and the work they've been doing with us for the past few years. I mean, that first episode, I don't think I can remember laughing so much.
I'm telling you, the team at Shush, I mean, Renee is just, what can we say about Renee? She's just magical. And she brings that spirit of what sex and intimacy is into the room, into her conversations, into her discussions. She just, put it this way, if you were quiet when you met her, you're not quiet by the end of that day or that evening.
It's a magical quality, isn't it? To
It
bring
is.
that out of people and to end the silence, the stigma and the shame.
Absolutely, absolutely. And, our collaborative partner, Shine, they have been phenomenal.
Yeah.
We really thank Emma for her time. She's very busy, but Shine Cancer Support have been a real asset
I know.
and a partner.
Yeah, so supportive and just being there for the community, the Shine
Yes.
community, people living with cancer, living with or beyond cancer in their 20s, 30s and 40s, and just really being present for what their needs are and not kind of creating any kind of shame around it. And of course, we must thank Macmillan Cancer Support, who have funded this project and made the podcast possible. Thank you. And there is, of course, a reason that we called this podcast Untold Pleasure. The stories that our patients and the people living with and beyond cancer that have spoken across the breadth of this podcast, I mean, it's been absolutely amazing. And it's just shown that just because you have a cancer diagnosis, that doesn't mean you don't want to be a sexual being.
No, it doesn't mean that at all. In fact, as I always say, as and when and if it's appropriate, why not? Because if one and two of us are going to live, for longer with cancer, we need to have that quality of life. And we also need to rid ourselves of those 3 S's, the stigma, the shame, and the silence. It needs to go.
And we need to shout about those pleasures.
Absolutely. You've been listening to Untold Pleasure,
The Cancer, Sex and Intimacy podcast. Please like, rate and review this podcast because that is the best way that we can get this far and wide to the cancer community.
Please also follow us on Instagram at sex_cancer_intimacy or drop us an email on cancerandintimacy@gmail.com.
And keep passing that dildo.